Available record shows that out of over 5,049 medical laboratories in Nigeria, only 7 made the ISO 15189 international accreditation standard of the International Organization for Standardization's Technical Committee for Medical Laboratories. Now, the ISO 15189 2012 is an international regulatory standard for medical labs that, accredits a laboratory as meeting quality management systems and standard use by regulators. Now, accreditation bodies and consumers to confirm or recognize a lab's competence. So, might this be the reason for the variance in laboratory test results, that we do experience, from time to time in our country? What are the requirements for a standard lab? Do we have them here in Nigeria? If so, what are the gaps? What can be done to bridge the gap in the standardization of those medical laboratories? What are the implications of that gap on the public health of Nigerians? We're about to find out all of these on the program Nigeria Today. Welcome to the program, and I am Claire Adelabu Abdul Razak. Right, joining me live in the studio to look at the quality and standard of our medical labs in parts of the country. There are over 5,000 of them, but we've just been told that only 7 meets the ISO standard. That's it's of great concern. So we have invited the National President, Association of Medical Laboratory Scientists of Nigeria, Professor James Damen, to come here to share with us what are the issues. So let me quickly welcome him. Thank you for joining me, Prof.
Thank you very much, Claire, and
yes.
Good evening, viewers.
Yes, so let's begin, because a lot of people really don't understand when you talk about medical lab scientists, we just, groom over it and then laugh at it. But basically, what are your roles vis-a-vis, the public health of Nigerians? How critical is it?
Yeah, okay. Thank you very much. Medical laboratory scientists plays a very important role in healthcare delivery services. Before you become a medical lab scientist, you have to go to the university. You need what we call the entry requirement for you to get into the program. You have to write JAM and make sure that you get the cutoff point, and you study for 5 years in the university. After graduation, you have to undergo what we call mandatory 1-year internship program in a recognized and approved teaching hospital. And thereafter, you go in for NYSC, National Service. After that, you are now qualified as a medical lab scientist. Now, the role that medical lab scientists actually play in healthcare delivery services are: number one, we are responsible for making proper diagnosis of diseases that is affecting our people. And we don't just stop at that. Investigation in the lab will also go a long way in also identifying the antimicrobial agent we call antibiotic that the organism is actually sensitive to, that the clinician should use in administering to the patient so that the patient can actually recover. Medical laboratory scientists also do an investigation to find out the damage, because usually when you are infected with microorganism, it causes some damages in your system. So it is the responsibility of the medical lab scientists to actually find out the damage that this organism has actually caused in the body. Medical lab scientists will also guide a clinician on when the patient is supposed to commence treatment, because we have some infections, for example, viruses. Let's say somebody is having hepatitis B or hepatitis C viral infection. The fact that somebody is positive for those viruses does not mean that the patient will commence treatment immediately. So it is based on the parameters that are generated in the laboratory that will actually indicate whether the patient can commence treatment now or he can commence at a later date.
Okay, so
it is also in the lab.
Yes, basically, because I know you can go on. I wanted to, have an idea of the relationship, the nexus between what you do and, public health delivery in Nigeria. Basically, is that of diagnosis and investigation of, samples.
Yeah, we apart from diagnosis, we also do an investigation to also determine the health status of an individual. And then we are also involved in surveillance and also, prevention and control of diseases generally.
Okay, so in terms of skills,
yeah.
Skill capacity, is Nigeria lacking in that area?
Well, during the training, actually, by the time you have what we call Bachelor of Medical Laboratory Science, we have given you the basic, requirement or the basic skill that you can actually perform investigation. But that is not enough. And that is why there is need for you to have what we call postgraduate qualification. You have masters, you have PhD, and presently, the World Health Organization, we call the Africa World Health Organization, have actually given approval for us to commence the West Africa Postgraduate College of Medical Laboratory Science. And so that one is actually to train specialists in the various aspects of medical laboratory.
Prof, why I'm asking?
Yes.
I want to mainstream the professional strength, our professional strength, in this area, vis-a-vis again, the reports we're getting about just 7 out of over 5,000, medical labs in the country not meeting international standard.
Yeah.
Because it doesn't follow.
It doesn't follow. Yeah, very correct. Now, let me also tell you, as professionals, we have on several occasions give position papers to government to follow so that all the labs, it is the intention of medical lab scientists in Nigeria that every lab in Nigeria, from primary to secondary to tertiary institution, once you say even stand-alone laboratory, once you have that, it is expected that those labs should be properly accredited. The advantage of doing accreditation is that you are sure of the result that is actually coming out. If you go there and you said you want to do malaria test, the result that is given to you is authentic, is reliable, and it can be reproduced anywhere in the world. That is the advantage of it. So we have been advocating that it is no fear for Nigerians to go to a lab that is not properly accredited. And we have the skill. But the most important thing is that there are no system on ground. Okay, let us look at the accreditation itself, what it entails, before we even talk about how Nigerians can even identify, an ISO accredited, laboratory and all that. So we talk about, I want to ISO 15189. We're also talking about ISO. I just want to get ISO 17025. Yeah.
What do they emphasize, really?
Yeah. Everything is about quality management system, and that is what we advocate, that it should be applicable to all the laboratories. But before you can even go into accreditation, like ISO 15189, before you can even go into international accreditation, there is what we call national accreditation. And this national accreditation is actually anchored by the Medical Laboratory Science Council of Nigeria. And they have tried their best to ensure that all labs in Nigeria should actually key into the mentoring program, because it's a stepwise process. And so, but the major problem that we have in Nigeria is that, I'm sorry to say that medical laboratory science is a profession that it is not properly coordinated. It is not properly, structured. And the reason is just because government fail in their own responsibility to ensure that this thing is properly done. Now, what do I mean by that? In the first place, you need to have a department of medical laboratory services where the professionals will be in charge of that department and they will be able to put everything right. But do you know that presently, check around, in fact, almost all our labs are headed by medical doctor.
Is it all about who heads? Is it all about the hands or the personnel that are manning, or about the quality, the equipment, the sophistication of the technology that you've put that, you know, makes a lab?
But let me tell you, the most important thing is the leadership is very key. Once you don't have the right leadership, there is nothing you can actually do about it.
That is why I asked you, what does ISO 151, what does it emphasize?
That's what I'm telling you. The most important thing is actually to make sure that there is a system on ground. Okay, you structure, you have a department. You also need the personnel that are also on ground, the qualified personnel. You also need the equipment that are of what we call state-of-the-art equipment. You also need potent reagent. You also need the procedure that have to be adopted. There's what we call SOP, standard operating procedure, that has to be followed. And if you have a department like medical laboratory science that is not properly coordinated, who is going to give direction? Who is going to give directives that this is the procedure that you have to follow so that you can be able to get accreditation? So the problem is actually from the leadership of the laboratory.
Which of these 7 labs are we talking about?
No, we have that meet up international accreditation.
Yes.
We have, for example, I am proud to tell you that in Plateau we have 2 of them that they actually have international accreditation. We have one in JUT, Jos University Hospital, the EPIN lab, and then we also have the Plasverec. It's actually supported by Institute of Human Virology. Then in Abuja too, Abuja have 2. They have the Defense Reference Lab in Abuja, and then we also have the NIMA. Nigeria Institute of Medical Research.
What about the one in Lagos?
That's the NIMA.
Okay, that's the NIMA.
Yes.
Yes.
You know. Okay. So, and if you look at it, they are most of these labs are actually supported by external. They got external funding.
Yes.
But if you look at it, Nigerians have been government. The truth of the matter is that they have been trying. They have been sending a lot of funding to a laboratory, but the funding are actually not properly used.
Are these labs basically are they to deal with, you know, very complex situations? Because I know that like you mentioned, primary, secondary, and you know, whatever labs. There are smaller labs where you go. I mean, if one has malaria, you know, you are asked to go to a lab. You just go to a lab and you give them your specimen and all that. Are you also required to get some form of standardization?
Ideally, like I said, every lab in Nigeria is supposed to be accredited. And even this accreditation, we have different levels. You have a lab that is accredited with 1 star. You have a lab that is accredited with 2 star, 3 star, and all those ones that meet up with international standard, which means we say they are 5-star lab.
Professor Damien, I'll pause you for now. When we come back after this break, we'll ask you to give us more details about, you know, the different stars and what they mean, you know, for our medical labs. But don't go away for you. We'll be right back to continue with our discussions on standardization of medical laboratories in Nigeria. We'll be right back. Professor James Damen is right here with me, and he's the National President, Association of Medical Laboratory Scientists. He just said to me, you can't give what you don't have, and he was almost choking. Sorry about that, Prof.
Yeah.
But talk to us. You talked about the different stars, ratings for medical labs in Nigeria. And would you say, because of this gap, or this gap is responsible for the variance? Sometimes, you go for lab tests, you come out with different results, you need to get a second, third, confirmation and all that. Is that responsible for it?
Yes, very well. Once the lab is not accredited, which means that the quality of the result that are produced by that lab cannot be reproduced again. And so it becomes a very big problem for us. And that is why, even as professionals, we advocate that any lab, so long as you now say it's a laboratory, that anybody can go there to do, whether it's urinalysis, just urine tests, or malaria tests, as you said, it should be accredited from primary healthcare, secondary healthcare, and tertiary healthcare. And so the different levels will also specify the type of investigation, the type of test you can actually do in 1-star lab, 2-star lab, and 3-star lab. The 5-star lab, that does not mean that you can do every test. It's not that there are certain tests that are restricted to. No, but you can also do there. But the most important thing is, when you have 5-star laboratory, it simply means that you are having international accreditation. And the advantages of having an accredited result from that lab cannot be overemphasized. You are sure of the result that you are getting. Because the major problem we have, which is also responsible for medical tourism, is actually wrong diagnosis. And the wrong diagnosis is actually produced from the lab, not because it's the fault of the laboratory, the lab scientists, but it's the fact that when there is no proper leadership of the laboratory, there is no proper coordination, even the equipment that you buy, so long as the end user is not even part of how that equipment will be bought, is a problem. And then also the reagent. There is an aspect of what we call quality control. For every reagent, even when you buy an equipment and you take it into a laboratory, the equipment is supposed to undergo what we call calibration. And who can do that calibration? It has to be a qualified medical lab scientist.
So what do you think has been the impact of this on our health system, especially in this new normal era of COVID-19?
Yes, it's actually responsible for the poor indices that we have in our country, and especially for even this COVID.
How do you mean poor indices of COVID-19?
Poor indices, because our proper diagnoses are not met. So we have what we call misdiagnosis, and like I said, it's not the fault of the medical lab scientists. When they are buying equipment and then you, the end users, you are not even involved on how that equipment is acquired. The reagent, you are not even involved, how the reagents are. So no matter how skilled you are, when those things are not properly put in place, there is no way. You are not a magician that you can go on. Remember that medical lab science is actually scientific application of techniques and method, on all those samples for you to come up with a result that is reliable and it can go a long way in helping the patient.
So you are concerned basically about the quality of our diagnosis?
Very well. Very, very well. We are so concerned, and we had submitted severally position to government on how these things can actually be corrected. And let me also tell you, we have laws that guide us. Nigeria we observe rule of law in Nigeria. We have gone to, our association have gone to a law court, asking the court to look at this laboratory. Whose responsibility is it to actually head that laboratory? I'm happy to tell you that we have over 14 court judgments delivered by eminent justices in this country, that anything that has to do with medical laboratory, medical doctors should hand up, allow the medical lab scientists, because that is their area of expertise.
There's so many labs here and there, and I mean, any Nigerian can just get up and go to one of such labs. How can we recognize a standard lab?
The only way is, like I said, even this issue of accreditation, we have two types. Like you have a national accreditation, then you have the international. Usually, you don't just go into international. You must get the national. The country must give you that accreditation before you can move to the national accreditation. And so the Medical Laboratory Science Council of Nigeria is actually charged with the responsibility of mentoring laboratory to attain national accreditation. But you know that there was a time they even released a circular that all laboratory, whether public or private, they should actually enroll into this accreditation program. But before you know it, doctors went and connived and then said they cannot come to their hospital and accredit the lab. And so when you have this type of problems, how do you expect the laboratory to be properly coordinated? So that is where the problem, and that's why I said leadership is very key.
Fine, let's quickly round off our conversation by looking at what can be done. How can, because again, we all know that government cannot do everything alone.
Yes.
Now, all over the world, there's private-public partnership and all that.
Yes.
How can governments come in? What do the people themselves need to do?
Yeah.
Quickly in 60 seconds.
Okay, fine. Our submission to government is that the laboratory need to be properly structured. In fact, we can even start from the local government to the states and also to federal. Ensure that there is a structure, there is a department in all this level. Up till now, Federal Ministry of Health deliberately refused to create the Department of Medical Laboratory Services, and which is disservice to Nigerians, because we are talking about coordination. There is no way you can talk about accreditation without coordinating the laboratories. So it is, once we have this structure in place, and then these structures too are manned by qualified personnel, medical lab scientists. Definitely, we all know about quality management system. You can bring anybody. Once you are not a medical lab scientist, if we are talking about quality management system, to you, it's just like somebody is telling a story. So all that we need is, let us have the structure in place. And once we have those structures in place, we should have the interest of the patient. I keep on telling our people that, look, today we are a healthcare provider, tomorrow you can be a patient. So once we strengthen the laboratory, in fact, it will go a long way in strengthening healthcare services.
Oh, a very good point, Professor James Damen, to end our conversation. And you've raised some very vital issues indeed. I do hope the Minister of Health is watching, and we will take this conversation even higher. We'll raise the bar on it. Thank you once again, Professor James Damen, and he's the National President, Association of Medical Laboratory Scientists of Nigeria, and that's the much we can take on this discussion. We do hope you found it worth your time. The program is Nigeria Today. It's live every weekday at 7:30 in the evening. You can also watch this and other editions of the program on www.youtube.com/NTA News 24 Hub. My name is Claire Adilabo Abdul Razak, on behalf of my production crew. Have a wonderful evening.